A very good morning and thank you for waking up to Sunrise at Sea here on CTV. Welcome to our Wellness, Beauty and Lifestyle segment. My name is Agi Owase. Today is a beautiful day and we are talking about diabetes, or what people call blood sugar. It can be too low or it can actually be too high depending on the diagnosis that your doctor will give you. And joining me today is a health consultant, and that is Mrs. Peace Chambade, who works with Norland, Uganda. Good morning, madam, and thank you for joining us.
Good morning.
Yeah, so let's talk about diabetes, or what people call, so many people call it diabetes, others call it blood sugar. It can be anything, but at the end of the day, people do understand what it means. So give us an overview as a health consultant. What is diabetes?
Diabetes, this is a group of diseases that result in too much sugar in the blood. Can be high blood glucose.
Too much. What of those who are diagnosed and you find it's too little sugar in the blood?
Still, it is the same. It's just that the difference is some of it is low and some of it is too high. Yes.
So now let's talk about the types of diabetes.
There are a few, but the most common ones are type 2 diabetes and type 1 diabetes, of which type 2 is a chronic condition that affects the way the body processes glucose. And type 1 is a chronic condition in which the pancreas produces little or no insulin.
Okay, now you have told us about the types of diabetes, so would like you to break them down. What differentiates diabetes type 1 from type 2? What differentiates it from type 3? How can someone know that I have type 1, I have type 2, I have type 3?
This is a condition that is only detected by doctors when you go and they test you up. It can be a scan, it can be a blood, actually taking a blood sample and testing you. You cannot diagnose it yourself offhand. You need a medical personnel to do that for you. Type 2 is when you produce a lot and the body does not process the glucose well. And then the other one, type 1, is when you have either you are not producing insulin or you are producing too much insulin. So those are the differences.
So here at Norland, Uganda, have you dealt with any people who have diabetes?
Yeah, we usually have type 2 diabetes people, and we have products that actually make it stay
at that same level,
detectable levels.
Okay.
Yeah, good levels for that the person is comfortable.
So it's basically only people who have type 2. You don't.
No, we have both type 2 and type 1, but the most common one is type 1 diabetes, when it's the most common one. And those are the ones we have dealt with mostly.
Okay.
Yes.
So let's talk about the signs and symptoms of diabetes. How can someone know that I have diabetes? Even before walking into a health center, before walking into a pharmacy, are there any of those signs that I, as an individual, can detect even while I'm at home and say maybe I might be having diabetes? Yeah,
usually there are no symptoms for diabetes, just offhead, but there are some things that are triggers that you can tell there's something wrong. For example, excessive thirst, excessive urination, excessive fatigue, weight loss. You eat, but you just keep losing weight without an explanation. Or when you cannot see properly, you have blurred vision, then you can tell there's something wrong. Run to the doctor.
You talked about excessive thirst, but there are some people who actually never drink water at all. So that can be a reason. That can be a reason why someone may be having excessive thirst, because they don't drink as much water as they should be taking. So how can I know that it's not because I've actually not taken enough water, my body needs water, or maybe it's because I have diabetes? How would I know?
The excessive drinking, the excessive thirst we are talking about here is like you drink like 5 liters. It can be of milk, it can be of juice, but you feel even after you take it, you still want more. You know, that thirst that is unquenchable. Then you have to go to the doctor. Even if it is your child who starts demanding something to drink all the time,
Yes.
you can guess there's something wrong. Then you just go to the doctor.
Okay.
Yes. To
Having
find,
known how we can identify if we have diabetes, so what are some of those causes? What causes diabetes?
most causes, some of the causes are weight. The more fatty tissue you have, the more resistance your body has. Their cells to become, to do the insulin. Then family history, it can be related to age or race or ethnicity. Then gestational, the pregnant ladies who get the diabetes. Then we have polycystic ovary syndrome, or somebody has high blood pressure. High blood pressure can cause diabetes. Yes.
So you actually talked about the fact that it can be genetic. However, if a family knows that they have a history of diabetes in their line, how can they prevent other family members? Is it preventable? Can they prevent them from getting diabetes in any way? Let's say for a pregnant mother, is there anything that they can do to prevent their child from having it?
Some of the measures you can take if you know in your family you have diabetes is you change your lifestyle. There are some things you avoid from day one, and then your life will have a chance of not actually getting your father's or your mother's diabetes.
Okay. Now let's talk about the risk factors that are involved with when you have diabetes.
Some of the risks that you can actually get when you are diabetic is you're losing feelings in your limbs, in your legs, in your hands, and some of those are the risks. And then when you are not feeling, then you get wounds, and those wounds can refuse to heal. Then you also have blood vision, so if you can't see, that means you can easily knock if you go to drive.
Yes.
There are so many other risks that are there involved with when you have diabetes. Then you can also develop some other heart disease, kidney failure, all those things.
Yes.
So it is much better to have it in check all the time and be on your medication. Once you are diabetic, you have to stay on medication day in, day out.
Until the end of time?
Yes.
That's very unfortunate. Okay, now for the people who don't have diabetes as yet, because besides you getting it or having it genetically, transferred to your body from your parents or your lineage, is there any way someone else can avoid, getting or being diabetic?
Yeah.
For those that don't have it, yes.
For those that don't have it, watch your weight, do exercises, and for God's sake, your lifestyle has to be healthy. Then you can avoid.
You talked about your living a healthy lifestyle. What are some of those things that are incorporated in having a healthy lifestyle?
A healthy
Besides the exercise bit of it, you've already talked about it. Besides eating healthy, what are some other things that anyone can incorporate in their life?
Sleeping 8 hours is a healthy lifestyle. Being happy always and pleasant is a nice lifestyle. And always having a positive attitude is a nice lifestyle.
Healthy lifestyle. There you have it. You need to actually have a positive attitude towards life in order for you to live a healthy lifestyle. So as we wrap up the conversation, Mrs. Peace, what are your final remarks in regard to diabetes? For people out there who have it, how can they, go on with life with hope that, even if it doesn't go away anytime soon, how can they live their lives happy? And also for someone out there who doesn't have diabetes, how can they live a better life?
If you are not yet diabetic, do whatever you can to avoid becoming diabetic. Like the things we said, lifestyle, positive attitude, and having 8 hours of sleep.
It may not be possible for some people to have 8 hours of sleep, but what she means is actually have enough rest. It's very much important. And that has been Mrs. Peace Chambade, a health consultant, who was weighing in on the issue of diabetes and how it can actually affect your life. And that right there winds up what we had for you in this segment of our wellness, beauty, and lifestyle. Keep watching Sunrise at Sea, and don't blink.